Welcome to today's Covid-19 vaccine and vaccine hesitancy training session for social prescribing link workers. Many link workers are playing a part in the vaccination programme by providing support in waiting areas, contacting patients, picking up referrals and helping GPs proactively identify people at risk of not receiving a vaccination they are eligible for. So it's really great to see so many people join today, and largely, you are largely social prescribing link workers, so that's fantastic. So many of you playing a big part, as I said, and we appreciate that people still have lots of questions about what is the right information to share with patients. So we wanted to provide this training session to help you with this. So for today's session, we'll be covering information about the vaccines, what vaccine hesitancy is, and how to approach and manage conversations with patients who are showing signs of hesitancy, fears or concerns. The session is being recorded, as you know, and the slides and recording will be shared with you after the session. It will also be uploaded onto the Healthy London Partnership website and circulated via Eventbrite. So please use the chat and Q&A function to ask any questions that you want to the panel. It would be really helpful if you could add the name of the person you want to direct your question to. So if you could do that, that would be fab. And also how we're going to end the session. We'll basically, send you a feedback form. We'll send the slides and FAQs that come out of today's training, and we'll be sharing that with you. So if you can move to the agenda, Nina, that would be fantastic. So the next slide. You can move through to the next slide.
Has it come up, Kerry? Sorry, there might be a bit of a lag. Bear with me.
No worries. Okay, so whilst Nina's just bringing up the slides, so the running order of today's session, we're going to have Dr. Leonora Wheel from Public Health England, who's going to talk about the picture across London, so what's happening with the vaccination programme in that sense. And then we've got Dr. Mohan Sekaram, who's going to be talking about the COVID-19 vaccines, hesitancy and the kind of questions people have about the vaccine. And then we've got Anne Bowers, who is going to be talking through the community training programme that she has established and is running amazingly in Newham. And so that's a community champions programme. She'll go into more detail about that. And then also we'll be supporting a peer support training session. So we'll go off into breakout rooms. You'll receive an invite for a breakout room too. So lots of invites firing your way today. So if you can join that when the time comes, that would be fantastic, and that's your opportunity to just go off and role play and go through what you've learned from today. Then we're going to have the Q&A panel, so that will be back with Leonora, Mohan, Anne and Dr. Jagan John, and then we'll be wrapping up with reflections, a resource pack that's been created for you, and then we'll check out. So I just want to say thank you, a big thank you to Leonora, Mohan, Anne and Jagan and my Healthy London Partnership team for supporting today's training. Like, you've really been amazing to help me pull this together and be part of it, so thank you. Okay, so Nina, are we all right to go to the holding slide for Leonora?
Yep.
Wonderful. Okay.
So
thank you. So yeah, welcoming Dr. Leonora Wheel to present now.
Perfect. Thank you so much, Kerry, and thanks so much to all of you for your time today. It's brilliant to be part of this really, really important event. So as Kerry explained, I'm Dr. Leonora Wheel. I'm a public health consultant working at PHE London in the regional team, in the regional ops team, looking at COVID prevention and control and really focusing there on vaccines. So everything around uptake, hesitancy, engagement, in exactly in this way. And what I'm hoping to cover and I'll keep it to time because I know we're running a bit late, is really four main things. So to talk about the London context overall, because I think it is important to pin this against where we are with COVID more generally, to look at the picture of the vaccination across London, then to consider a little bit about what we know from Londoners around vaccine uptake and hesitancy, and then to talk about the approach that London partners are doing in a regional way, and where you all fit within this really, really important part of the programme. So if we move to the next slide, so just as I said, to put this in context, so we know that London's case rates are declining, and the roadmap leads a way forward, which is really good news. We're past the peak of the second wave, but we're maintaining cautious because we know that there's increased transmissibility of the current dominant strain and risk from new variants. So we're maintaining that message when you have your conversations, that stay at home, remember your hands, face and space, getting tested regularly, and testing if you've got symptoms. And important also to remember that NHS colleagues within London are still dealing with lots of COVID-19 patients. It is less than it was. And to remember within all of this, the huge number of people who've tragically died across the UK and across the world to date. From the next slide, looking at the vaccine programme more generally. So we know it's the biggest vaccination programme in NHS history. And actually what's been really nice over the last few months and weeks as the programme's got going is speaking to different people. And this is such a historic event that everyone's got a COVID-19 vaccine story. And in your roles, you play a really important part of that. And I think it's important to remember. So from February 25th, and the numbers are going up all the time, over 18.2 million people have been vaccinated in the UK and over 2 million vaccinated in London. And again, I think that's really important. We'll come up to this a little bit more in terms of a lot of the things that people are saying, I want others to get vaccinated first. We've got so many people vaccinated across the world, but within the UK, there's huge numbers, and how successfully we're really doing across the UK as a whole. And the key message is, to keep your heads around is that an effective vaccine is the way out of the pandemic. It's the way to, the more people are vaccinated, the more people will be protected from the harmful effects of COVID-19, and having vaccination will save thousands of lives. So all of those being really important. If we move to the next slide. So I wanted to talk a bit about what we know about vaccine hesitancy in London, and I know Mohan will be speaking more about vaccine hesitancy when he speaks. So how do we know? And we know a lot about vaccine hesitancy. First of all, we know about vaccines in general. So we in PHE, we do huge, and working with NHS colleagues, lots of vaccinations programs. This is not the first one, and this is not the first time that people are expressing vaccine hesitancy. And I think it's important that people do not just accept everything that they're given, and they do have that time to question and have that time. And it's all about, and I'm sure we'll discuss today, that informed conversations for informed consent. So we have what we know about previous vaccination programs. We know what we know from the literature across the world. We know from studies, but we also there's general polls that are being sent out to Londoners every month through the mayor's team, and asking those questions. Why are you vaccine hesitant, and why? And some of the main reasons coming through, and these are specifically for this group of Londoners that have been asked, but similar to the picture we know more generally, is this lack of trust in the vaccine or a specific vaccine. It's not thinking the vaccine will be safe, and wanting to let others take the vaccine first. And who are the most resistant? And this is the picture in London. So we know across London, younger Londoners, so everyone under 25, that 18 to 35 group being very important. The communities, Black, Bangladeshi, Pakistani, Pentecostal, Orthodox, Christian, Muslim Londoners being resistant, those in deprived areas, and people with mental illness, learning disabilities, and inclusion groups. And I think all of these need attention and discussion, and I'll explore this in a little more, and I know my colleagues will be as well. But the young Londoners, a lot of people say to me, why are we worrying about the young Londoners? We're not vaccinating them yet. But I think it's really important to remember a lot of these young Londoners will influence their parents, multi-generational homes, grandparents. They're the ones who might be having conversations to them, urging them to get the vaccine. And we're not that far off. So we're coming to Londoners by April, we'll start vaccinating them. And we need time to have those conversations. We know they're resistant, and they want, as I said, this informed conversation, and absolutely correct that they should know the facts and be able to have those conversations. And that's really where you come in. So again, if we move to the next slide. Lots of models of what, how the vaccination and where hesitancy comes from, and this is adapted from a number of different models, but it's thinking about what people think and feel, the impact of the social process, the motivation to vaccinate, the practical aspects of vaccination. We know some of it's around having a convenient time slot, or being able to get there, or being too nervous to go out into the open and get the vaccine, and then the aspects of the vaccine itself. And I'm not going to spend too long on this because, again, I know Mohan will be exploring hesitancy in more detail. But if you look at the bottom, the yellow boxes are about factors affecting your likelihood to vaccinate. But these orange boxes are the mitigating factors, things that you can do to help people be vaccinated. And really, if you look at the first orange box, that shows really the absolute vital importance of your conversations with people. People say repeatedly, and this is what we've seen from the literature, but also from conversations our teams have been having with communities and with people, that they want people who look like me, who sound like me. They trust the influence of friends and family, these trusted messages, things that are not stigmatizing, culturally competent communications, and being able to ask those questions. Again, it needs to be this information, and you are able to have those one-on-one conversations, those conversations with them, to be able to address any concerns and needs that they have. And that's why what you do is so important within this picture. If we move to the next slide. I'm going to just, I know Anne's talking, so this is adapted from their ladder of support, all these various ways of where we can affect how people take vaccines or not. And you've got those community champions, co-production, social prescribers in this way. And then the next slide is really looking at what our approach has been within PHE London and our team in tackling vaccine hesitancy. So, and the first thing to say with this is the absolute high priority this has had within London, obviously within the regional team, but within all our organisations, within PHE, within NHS, within GLA. Every organisation is really focusing on this, and that's why what you do is really so important. So we're looking at the data and evidence to make sure all of the things that we're saying are backed with what the evidence is saying, and we're understanding that data, and that's what we've done today, starting with seeing what the numbers are and who's being affected. Addressing hesitancy, so we're doing a number of initiatives across London with town events that are open more generally, working with programmes such as this, and Anne's doing a lot of work with community champions, looking at the practical aspects of vaccination, so to make sure that we are addressing not just people's doubts, as I said, but also how to get them to the vaccine, and making sure those communities who are harder to reach are able to access vaccinations in the same way that all communities can. And finally, that evaluation, monitoring and system leadership. So making sure whatever programmes we're doing are evaluated, we're seeing what's happening across London and in all our boroughs with all the work that's happening, taking the learning and bringing that back into the system. So that's the broad programme. I hope I've given a bit of an overview of what's happening in London. And again, a huge thanks for all the work that you're doing, because you are able to have those connections that on a regional level we can't have in the same way. And you are helping us have those conversations with people. So anything that we can do to support you, we're more than happy to do. Thanks so much again.
Wonderful. Thank you so much, Leonora. That was so helpful. And if anyone has any questions from what Leonora has just been sharing with you, please pop them in the chat and we can ask them during the Q&A session. Thank you so much. Okay, so moving on to Dr. Mohan Sekaram. So going to be talking about the vaccines themselves and vaccine hesitancy. So Mohan, over to you.
Excellent. Thank you, Kerry. Great to be here. And thank you, Leonora, for what you mentioned. And certainly I completely agree. Link workers have a massive role in terms of supporting our population. So I'm Mohan Sekaram, I'm a GP in Merton, also the clinical lead for social prescribing, but also been working in the vaccination hubs and also contacting patients to try and get them to uptake the vaccine. So certainly lots to share. Next slide, please. And so certainly we've got 3 vaccines available, although 2 are currently being widespreadly used, and that is the Pfizer vaccine and the AstraZeneca vaccine. The Moderna one is in process, and we'll know more about that in coming months. The vaccines, and it's important to understand that all these vaccines have had vigorous tests for safety and efficacy, and they've been approved by our MHRA, so our Medicines and Healthcare Products regulatory agency, which look at all our medicines which are passed in the UK. So it's really important that no corners have been cut. There are some slight differences between the 2 vaccines, and obviously Pfizer has to be kept at very cold temperatures and utilised within a set time period of 5 days, whereas the AstraZeneca, again made in a very different way, can be stored for longer than that, up to 6 months. Both of them have effectiveness of over 90% after their 2 doses. So again, they both work in slightly different ways, slightly different storage patterns, but both as effective. Thank you. Next slide, please. So lots of sort of concerns and lots of things which people have been saying about the vaccines, and I think that misinformation has then passed on to other residents who then get concerned and then don't take the vaccine. So it's important that we give as much information as possible so that patients can make their decisions based on correct information. It's really frustrating when they make their decision based on incorrect information, which then doesn't help them and also doesn't give them the full choice. So really important to remember that the vaccines don't actually contain the virus itself. And so that's a key message, because people are worried about getting coronavirus from the actual vaccine, but you can't. I'll explain that on the third point. The vaccine also doesn't have any fetal animal material, no eggs, pork, beef or gelatin in any of these vaccines. Again, a very key point. And the vaccines work by utilising a protein or protein similar to the actual coronavirus. And that gets injected into the body, and that causes an immune system to make virus fighters against the actual virus. So if you were to get infected by coronavirus, your body would be ready for the attack and would be able to fight the infection. The worry is when you get coronavirus first time around, you don't have any immunity against it, and that can make things a lot worse. And so by having the vaccine, you're primed and you're ready to fight the infection when it comes on. And there's 2 sort of graphics at the bottom there which just show you how the 2 viruses work. I won't dwell on that too much, but it's there. Next slide, please. So who gets vaccinated and how have we identified how to sort of pass these on to priority groups? And there's roughly 20 million people who've been vaccinated to date, which is great. And so certainly needs to be done in a coordinated fashion. So it's been done in certain priority groups. So we started off in priority group 1, which was residents in care homes, staff in care homes, and also people who are working in the front line. Then we moved down to priority group 2, 3, 4. So we're now at priority group 6, which is looking at adults aged 16 to 65 who are at high risk, i.e. having diabetes or a high risk condition, or all those patients who are aged 65 or over. And lots of areas are working through those very, very quickly. It's really important that we don't jump down those groups, because there are some vulnerable patients who are elderly isolated, and we do need to keep contacting them because they may have not made their choice up, or we may have missed them. And so it's important that we ensure that we give them all the right information and decide. And lots of patients who I've been contacting now recently have had time to think and are now taking up the vaccine, which is great to see. Next slide, please. So who shouldn't have the vaccine? We can all have the vaccine. There isn't anyone who should be excluded from that. A couple of things worth noting. So allergies. So those patients who have allergies can have the vaccine. So certainly things like hay fever, things like a slight irritable rash, that allows you to have the vaccine. Those patients who have anaphylaxis reactions, i.e. they need to go to hospital or need adrenaline, they then can have the vaccine if we know what the allergen is, and certainly they can have the Oxford vaccine. Those patients where we don't know what the cause is, and they have allergies to any of the ingredients to the vaccine, then they will need to be done or spoken to with their GP just to ensure that they're eligible to have the vaccine, and they will likely to be done in a hospital setting where there's lots of support available. So that's the first thing about the allergies. Pregnancy as well. So obviously with pregnant women, not lots of tests have been done on this group, and therefore pregnant women, those who are at high risk, I have a high BMI or BME group, or have underlying health conditions, are encouraged to have the vaccine because there's a higher risk of further harm of not having the vaccine. Those at low risk are eligible to have the vaccine if they would like. And again, we would encourage you to speak, or encourage patients to speak to their GP or healthcare professional about that if they would like to have the vaccine. So two things there, allergies and pregnancy. When can people who have tested positive have the vaccine? So we ask for a 28-day free period from when you've last had a positive test to when you can have the actual vaccine. And how can we ensure equal access? So it's done by that table on the last slide. We're working our way through those criteria, and there's good uptake in those criteria. There's still certain cohorts and certain community groups which need extra targeting and extra support to get all the information, but that seems to be working quite well. And as I said, almost 20 million being vaccinated in the UK. Next slide, please. So how effective are they, and can people choose? So the vaccine can become effective, from 2 to 3 weeks after it's been given. So it's still important that we continue to social distance, wear a mask, and wash our hands. That's really, really key, that once you have the vaccine, that still occurs. People still need to come back for their second vaccine, which is 12 weeks apart, to get the full protection, to give them a booster to last longer. And again, the full protection really starts working a week or so after the second dose. You can't have one vaccine of the Pfizer and one vaccine of the Oxford. You need to have the same one for both doses, and we're encouraging that patients go to the same place they went to for the first dose. We're not really choosing either what vaccine you can have. How it's being distributed is based on the delivery coming from central government, and so they both are effective, they both work, and they both haven't caused many effects, and therefore we would encourage you to have the vaccine when it does come. And they're expected to work for at least 1 year, if not longer. Thank you. Next slide, please. So what are the possible side effects? So with all medicines, all vaccines, we may expect some side effects. Some of them are mild or short term, but we all tend to get them, and it shows that the body is reacting to the vaccine given to you. So some of the common side effects are painful, heavy feeling and tenderness in your arm at the site of the injection, because that's where you've had a needle put in. And this tends to be worse around 1 to 2 days after the vaccine. You may feel tired, you may feel headache, or general aches or flu symptoms. Again, these can be normal. They don't normally last longer than a week. So if you do last longer than a week, then you should seek someone from the clinician, or seek some medical advice. Next slide, please. So I sort of mentioned this earlier. So when you do have the vaccine, it's really key that we continue to follow the lockdown guidance. So continue to social distance, continue to follow shielding advice until further notice, and you need to protect yourself by wearing a face mask, social distancing, and washing your hands as well, following your lockdown guidance. I think if we all adhere to that, then we're going to certainly see these rates come down, which they're starting to, which is great to see. The vaccine will be a great armour against that as well. Thank you. Next slide. So what is vaccine hesitancy? So a number of reasons. A delay in acceptance or refusal of vaccines despite the availability of the vaccination services. So there's vaccines available. We're working our way down certain areas to vaccinate those who are eligible. It's complex, and certainly many people have different views about the vaccine based on their own sort of experience, also their place, and also what they're hearing from other people. So I think it's really important that we give as much information as possible, the right information, so they can make an informed choice. And these factors are influenced by complacency, convenience, and confidence. So if we look at the complacency, a lot of people will feel, well, I'm a low perceived risk, therefore I don't see why I need to take the vaccine. And this is found quite often in the younger population. And as Leonora said, they often may influence older patients who are more vulnerable into not taking the vaccine. So it's really important that that's a key aspect or key point to remember, certainly if you guys are having discussions with patients. Confidence as well. So confidence about they don't think the vaccine's safe. Not many people they don't feel many people have had them so far, although the statistics have said 20 million patients have had them, and we need to share that experience. And convenience as well, so barriers related to that, so acceptance of getting the vaccine. So certainly we're having our vaccination hubs, visiting the housebound, and there's certainly lots of pop-up hubs being developed now, going to faith groups, mosques and churches. Certainly we had one in Merton just last week, which was very successful. And so some factors which are known to affect the uptake are some of the perceptions. So we touched on that, the safety of the vaccine, the effectiveness of the side effects, and some of the social influences. So people who know people have had a side effect, or family, friends, or connections who have recommended them against the vaccine, and certainly conspiracy theories as well. So we need to take all this into context and give as much information, because people need to make that choice based on their own beliefs. Thank you. Next slide. So quite a lot of misconceptions and certainly concerns we've had, and certainly some patients feel, well, and I had a call last week that I've had the vaccine, does that mean I don't have to follow restrictions? No, you do. You must continue to wear a mask and wash your hands and social distance. That's really, really important. And what it does do, it does give that confidence for people who've been isolated to then leave their house. A lot of patients have been isolated for long periods of time. So this just gives them that bit of confidence to do that. If you want to start a family, you shouldn't have the vaccine again. That's incorrect. And certainly we would advise you to have the vaccine. It's not known to be harmful, and no evidence against that. And so we would encourage many people getting vaccinated as much as possible. Again, the allergies we talked about. So those who have severe allergies or anaphylaxis type reactions may be recommended to have them in the hospital setting. Everyone else who has a mild allergy or has not needed hospital requirement, then it is safe to have the vaccination. You can get the COVID vaccine after having both doses of vaccine. Again, you won't get the COVID from the vaccine itself. You may get COVID afterwards if it's not effective against yourself, but it's very, very low, those levels. The vaccine has been made too quickly and it can't be safe. So again, how do we rush this out very quickly? And the reason behind that is a lot of the red tape has been removed, a lot of the barriers which has been in place before has been fast-tracked to allow that this vaccine is being passed out as quickly and as effectively as possible. And the last one as well about changing your DNA, that there's no evidence of that being the case with any of these vaccines. I think that's my lot, actually. I think, is there another slide, Kerry? Thank you.
All good. Thank you so much. That's really, really helpful. Really encourage people to pop questions in the chat if you can. Conscious that some people might not be able to see the chat. So if anything, if you've had any questions coming through, we will be going out into the breakout area shortly. So if you want to pop your questions in the chat box there, or alternatively you can send me an email to hlp.socialprescribing@nhs.net, and then we can put those questions to the panel a little bit later on. So it seems that Teams isn't playing ball so well today, but hey, we need to experience this to know that it's not always plain and smooth sailing, is it? We're up for the challenge. So we've got Anne coming on next. So Anne Bowers has been leading on a COVID-19 Community Champions programme. So she'll be doing a role play session with us as well shortly, but I'll let her introduce herself properly, much better than I have, and just talk through what we're going to do next. Anne, are you there?
I am, yes.
Wonderful. Just a little bit quiet.
I'm not a fan of Teams. Can you hear me now? Is that better?
Slightly faint, but we can hear you, yeah.
There's nothing I can do about it. Sorry about that. So anyway, good morning. My name is Anne Bowers, and I'm the community engagement lead for the London Borough of Newham. I joined the borough last May to really support in a conversation between the borough and the community and the borough, so that we're kind of really clear about what questions, what concerns people have around COVID and how we can respond. And the first, so next slide, please. So what I'm going to talk about is peer support, how does it work and what we cover in the training. But before I do that, Kerry had asked me, I spend a lot of time at the moment running question and answer sessions about the vaccine. And Kerry had asked if there was anything kind of to add to what Mo had said. And the thing I would add to what he'd said is just to reinforce that all of the questions that he referenced and all of the information he provided is exactly the same kinds of things that we get asked in Newham all the time. The other thing is that, you know, the questions are sort of the top of people's just nervousness. They're people just kind of nervous because it's a new disease, it's a new vaccine, and ultimately we're all being asked to sort of trust the scientists and trust the regulatory process. And for different people, that's easier or harder to do for all sorts of reasons. And so in Newham, at least, we're trying really hard not to talk about hesitancy and not to talk about myths or low take up, and put the sort of the responsibility for the comfort, for feeling okay making the choice to have the vaccine, sort of quite firmly in the system. It's sort of our responsibility to help to give as much information and as much space and time for people to explore their questions so that they can feel comfortable taking the vaccine, rather than it's a sort of fault or problem or irrationality on the side of the individual. And that's where the peer support program comes from. It picks up on the idea that, or not the idea, it picks up on the evidence that people have a lot of questions about the vaccine, that they want to have a space to have those questions answered, and that often having those questions answered in the language that makes sense to them works better. And that isn't because people don't necessarily speak or understand English. It's not a kind of either you're an English speaker or you're not an English speaker, but because when you're talking about something that makes you nervous, or you have a trust question, or you need to feel comfortable with, often it's the language of home that works best, or the language of family, or the language of community that works best. I mean, despite my accent, my parents are English, and when I obviously didn't grow up in England, I grew up in the States, but when I need something really clearly explained, or when I'm sort of stressed, there's something about an English accent that kind of calms me down, because that's the language of my sort of safer space. So just and I'm probably not telling you anything you don't know and experience in your day-to-day work. More to say that from a public health team perspective, we're really trying to put in place resources and opportunities for people to have the conversation in the place that's the safest for them. Next slide, please. I guess the other thing to say is that when we do peer support training, and when the reason for our peer support program and all of the other programs that we have under my kind of community engagement work, the reason we do this is because we do want people to take the vaccine. So it's not a neutral conversation. It is absolutely a bias. We absolutely have an aim that people take the vaccine, and that is because it's the way to keep people safe and keep people from dying in COVID. The only other way is to stay locked in our houses forever, and I don't think that's possible or that anybody wants that. So that we're explicit about that, but we're also explicit that that's a journey for every individual, and every individual takes their own unique path. Next slide, please. The vaccine, sorry, there's a homeschooling situation going on right now. The door just got slammed. The vaccine, it's really important, back to what Mo said about, you know, this is, just because you've had your vaccine doesn't mean the sort of pandemic is over for you. The vaccine is part of a whole range of activities and actions that each of us need to take as individuals, and that the councils on NHS and other services are supporting people to do. And I'm not going to kind of run you through these, and I'm sure you've talked about all of them with the people that you support and the communities that you work with. It's more to say the vaccine doesn't sit in isolation from other parts of our COVID response. Next slide, please. So what is peer support training? We provide, and this is not even as, you know, it's not as detailed as the training that you get as social prescribers. We provide a 2-hour training session to members of the community. They can be anybody. The sign-up process is straightforward. You just say you're interested. And it's a bit like we're doing today, this morning. It's a sandwich. There's information about peer support, then there's information about the vaccine, and then there's a chance to apply the peer support to the vaccine. The main points about the peer support, or the supportive conversation approach that we take, is that we ask open questions without any judgment. So no matter what somebody's question is, I may think that it's a sort of kind of ridiculous question, or it's a question that's been answered multiple times, or it's a question that doesn't have an answer, but you know, it doesn't make a difference really to the safety or the efficacy. It doesn't matter. Somebody's question is their question, and no matter what we think of it as individuals, it's a legitimate question to them, and we have no judgment. And the other thing is we have it's not about changing someone's fundamental principles and belief. So I've been asked a few times when I go to churches about the relationship between the vaccine and faith. I'm not going to try and challenge somebody's faith. Their faith is their faith, but starting from a place of, okay, well, if you're coming from a place of faith, what is the role of God in giving people the capacity to do the science? Equally, if you're coming from a place where, as a community, pharma companies, medicines, the medical sector has in the past been not only neutral, but actually actively harmful, that's not something to change in somebody's belief, or not just belief, somebody's experience. And so you start from a place of, okay, that's not an easy place to be. How do we help you feel comfortable with this vaccine? Next slide, please. So we have peer supporters, and this is the way that we describe their role. This is not a game of how many people can they convert. It's everybody takes a journey to having the vaccine, and the peer support program is there to help people on that journey, and some level to kind of speed it up a bit. But it isn't, we don't ask our peer supporters to report back success or failure. We don't talk about it in those terms. If somebody has a conversation with someone and it just goes, thanks for the conversation, I'll keep thinking about it, fine. The aim here is for the council and the NHS to be providing people an opportunity to have their conversation. We support our peer supporters in two ways. We have a WhatsApp group, so they can ask questions regularly. Actually, what's amazing in the WhatsApp group is people are talking to each other. They don't really need me or my public health colleagues anymore. We keep an eye on it for accuracy and for the information being correct, but we don't need to engage with the kind of detail or the community creation. And then the other thing is we have drop-in sessions every week on Wednesday evenings on Zoom. Next slide, please. Okay, I forgot that I put this in. This is a lot of boxes, which basically say the same thing that Leonora said with her triangle, which is this is part of an ongoing offer of supportive conversations. And the thing to really take away from this is that the themes and the approach that I was talking about in the peer support training infuse and run through everything that we do to support vaccine uptake and to support engagement around COVID. So I've just read a letter that a colleague is writing about getting in touch with our contact tracing team. And I've said, do we want to put something supportive in this letter so that people don't get something in their door that says, we're from the government, we've been trying to reach you, call us back. I mean, I've got a pretty comfortable relationship with government and governance and governments, and I'm not sure I would respond to that kind of letter. Next slide, please. This is what we do in our peer support training, and it was really enjoyable to listen to Mo's slides, because I was like, yep, we have that, yep, we say that, yep, we say that. So there are some very specific and consistent messages and pieces of information about vaccines that we seem to all be giving out that are resonating with communities. The ones for me that seem to have the most impact, where I kind of see people's shoulders relax. One is that there's no COVID in these vaccines. So you can't get COVID from the vaccine. You can have side effects, but you can't get COVID from the vaccine. And then the other is that you don't have to do it now. And it's not, if you don't take it now, that doesn't mean you won't be able to take it later, but that it is a choice, and it is each individual person's choice. Next slide, please. Yeah, so I've sort of described how the peer support training works. I'll be completely honest with you. We have more peer supporters than we have people taking peer support up yet. And I think that's because we haven't gotten our kind of referral route or connecting route right. And we're trying to work through the GPs now, because they're poor. Their staff are exhausted, particularly their receptionist and practice manager staff, and in some cases their social prescribing staff, just exhausted calling people all the time to follow up on vaccine. I guess people saying they don't really want the vaccine or not taking it up. And so we're looking at how the peer supporters can help. That being said, the feedback from the peer supporters so far is that they've found the training really helpful in general in all the conversations they're having in their community. And we engaged them quite extensively last week after the shielding letters went out. And there was a bit of a kind of, why am I on this list? Who am I? And what do I need a vaccine for? And we used our peer supporters to have those conversations. And they're having them in their home languages. So we had one in Yoruba, and she's now made a video for us in Yoruba. We've had a number in Hindi, in Urdu, in Portuguese, so the languages that work in Newham. Next slide, please. So I've talked this through. We can skip this slide. This is just the process. I talked about the supports, the peer supporters. Next slide, please. Okay, so before we go into role play, I've always tried to emphasize the word play in this, because, explore, see what happens. Could we just hide this? Could we go on to no screen share and see if there are any other questions or thoughts that people want to give about peer support? And I've seen the question about the 0 hours contract if you get side effects. I don't know. I think that's we did some research in Newham about why people don't get tested or stay home if they're test positive, and it came down to the same question, and we haven't been able to solve that problem yet. And I'm sorry that I don't have a better answer for it, but I wanted to kind of acknowledge the question, because I think it's a really important one. Okay, any questions or thoughts, and in particular thoughts about how you think the peer support might relate to social prescribing? Someone says, how do we get around GDPR issues? So first of all, we like to talk about adhering to GDPR requirements, because as soon as we talk about getting around GDPR issues, it looks like we're pulling a fast one. The peer supporters so everyone is referred. They either self-refer or they're asked, would you like a conversation with a peer supporter? Or they see a poster that says, if you want a peer supporter, here's the phone number. And so they've consented to share their name, their phone number, And if they want to, they can share a preferred language, and the conversations happen by phone. And most of the peer supporters are comfortable with their phone number being seen. That was one of the other things we had to tackle, because there's evidence around answering phone calls if you can see the number or not see the number. Just to tell you a couple other things we're doing, Mo mentioned pop-up clinics. So we have pop-up clinics in Newham. We've had 2 in Gurdwaras. I think we've had 1 in a mosque. We're doing a few with our homeless, charities that support homeless, the homeless community, and we're working on some of the churches that serve the African and Afro-Caribbean community. By working, I mean working in partnership with them. The thing I have found with vaccine take-up is it's such a specific action and activity that you get people really come forward to volunteer and help because they can see how they can help. Wider community champions is a bit harder because they don't sort of see the specificity of the ask, but vaccine peer support and vaccine take-up, vaccine pop-ups we've been overwhelmed with volunteers. And then the other thing that we're doing that a colleague of mine is leading on is small grants to community organizations to have their own sort of in-house peer supporters that reach further into their communities, because there's only so far that I reach to peer supporters and peer supporters reach to others.
Great, thank you so much, Anne. That's fantastic. Always got so much that we can share. Thank you. So are we gonna be okay to go on to the peer support training part and get people into breakout sessions? Are you okay just to explain what people need to do? Thank you.
So
yeah.
So can we put people in rooms of like 4 or 5? Does that work?
Yeah, so what's going to happen is myself and 3 other colleagues are going to send everybody a breakout link. So you're going to have another invite popping in very shortly for you to follow and join, and we'll be there for however long Anne just says to us now. But then if we can come back to this main session afterwards, that would be really helpful. So we just want to kind of wrap up that role play exercise, and then we'll have the opportunity for you to ask more questions, and there's also other information we want to share with you towards the end of the session. So we still are aiming to work towards a 12 p.m. finish, but yeah, Anne, over to you.
So let's go in. We're going to go into rooms for about 10 minutes. Groups of 20. Okay, so we'll go into rooms for about 10-15 minutes and choose have somebody be a sort of somebody with questions about the vaccine, and then take turns sort of thinking about how you would respond. And since the groups are so big, use the chat function as well as the conversation. And remember, this is play, this is not perfection. And also, I'm very, very conscious that this is your bread and butter. So, if anyone knows how to have sort of supportive, engaging conversations that help people take up behavioral change, this is, it's this community of people across, it's you guys across London. So just see how it goes with vaccines specifically, particularly drawing on what Mo has said about the questions. So Susie's going to send you all an email, I believe. And
so it's going to come from Susie, Justina, Leanna, and myself. So sending them over now.
Great.
My whole family's had the vaccine because we all happen to be doctors, and we haven't had, but you are going to get cases where the people will have side effects. As long as we can sort of get them through that period, I think the message is clear that the vaccine so far has been a success.
And we often talk about the difference between side effects and adverse events. So side effects are things you expect from a vaccine, and they're the flu-y feeling you have for a few days and your arm hurting and those kinds of things. Adverse events are things you don't expect, and they're the things that might lead to someone being very ill or dying. And as Dr. John said, every one of those gets reviewed and looked at in detail, and so far none of them have been connected to the vaccine. It's about, we're vaccinating people who are already might be ill because they've who are ill in and of themselves in other ways. And also you can catch COVID after you've had the vaccine or have it just before, but you can definitely catch it in the first couple of weeks after you've had the vaccine. But the side effects are real. People feel fluey for a couple of days, and we just need to remind people that there's no COVID in the vaccine, and that's expected. That is what happens when your body has to create antibodies.
All right, thank you very much.
Harry, did you see my message? I think we need to bring people back.
Yeah, no, everybody should be back now. Sorry, I just didn't want to cut off Jagan responding to a question just then. So hopefully we've got a majority of people joined us back in the room now. Hopefully that you found that breakout session helpful. And is there anything that you wanted to close off from that part?
I guess my one question is do you find it different with the vaccine than other things you're already doing in social prescribing, or is the vaccine just another, it's another conversation, and what you do in your day, every day is have these kinds of conversations with the people that you work with?
In my experience, the vaccine is a very different prospect. It completely differs from the usual work that I have done so far as a social prescriber. I have never found so many people with being so skeptical about what is being offered to help them. It's a completely different world.
I mean, I don't want to, I know I'm conscious of the time, I'd love to know more about why you think that, what you think is driving that, and how we can help respond. But maybe that's for another time, because I'm conscious we only have 7 minutes before we're meant to close.
Yeah, we're going to wrap up. Yeah, thank you. So we have had a couple of questions coming through already. And so if you do have any in particular you want to pop into the chat box and then directly put the name of the person you want the question to be directed to, please do that. Jagan, I've got a question for yourself. So what's your experience with vaccine hesitancy, and how do you support your patients and staff through that?
So it's a really complex one, and anyone who says there's a problem with national strategies versus reality, I always say it's a mix of everything. So we have done telephone calls and face-to-face reviews. I've even brought patients into my clinic to just go through the vaccine. I've even been to people's houses in occasion. We have done webinars, as Mohan said earlier on, regarding vaccine hesitancy and dispelling some of the issues. And it's interesting, the questions in each of the webinars to different faith groups or different ethnicities or different hard to reach groups, it changes with time. In the beginning, it was all about fertility. It seemed to be a big one about does this affect fertility, and so on. And then, of course, the research and how quickly it was. Now it's becoming slightly different, more about how will I be after having and which one should I take. So it means that the public have changed, the views have changed. So I think it is something quite iterative. But in terms of hesitancy, it's about getting the languages. So there's all this material that Mohan mentioned and about literature in different languages. It's also about having that advocate through the social prescribing link workers or others, and the volunteers who are advocating and explaining things a bit more fully as well. And I think for me, it is making sure that we have a different approach according to the different needs of the population. I can't say we're just about to go on a bus, getting a bus going around our patch. We've done pop-up clinics. We've done in the mosque. We're going into the gurdwaras and churches. Sometimes it's to the children's centres. You get all different approaches going forward. And the message I've always said to my colleagues across London is that we've just got to keep putting the message out and keep trying, because as one of our colleagues earlier on in one of the groups said, sometimes people just need time. they just need time to digest all this information as well, and they need to process it. And I think most centres have come into a process that if you don't agree to have it, they come and revisit the same conversation with the same patient or the resident to say, look, do you want to talk about it again? Because people do change their mind going forward. So I think all I say is information, 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 but also giving people time. And sometimes GPs aren't the best people to give time because of their time. And one of the fantastic thing about our link workers and our volunteers and our coordinators is they provide that information and give it in a timely way. And I think that for me is the thing that shows that how important our link workers are for doing population work. It really is, because they just understand people and the community.
Great, thank you so much. Leonora, I've got a question for yourself, if you don't mind. So it was explained why the concept of the vaccine has been made too quickly, it can't be safe, isn't true. But how can you know what the long-term effects can be, i.e. 5 or 10 years down the line when the vaccine hasn't been around for this long?
So I can answer that. So the MHRA have to do projective. Don't forget that when a vaccine is done, in some ways there are also legal implications for any government or the MHRA, which talks about long-term effect. Long-term risks and things. So when they do this, when they assess a vaccine or even a new drug or anything, they have to take on data that includes something about the long-term effects. So some of the data will be, as you quite rightly say, will be as we go along, we will find out to see if there's anything going on. But they have done some work on what possible risks there are to the population in the long term, because don't forget, the NHS is still responsible for all of these risks. If you get unwell due to a vaccine, the NHS has to pick it up as well. So it isn't just a simple decision to allow a vaccine just for the sake of the government pressure. There are risks to the people that who are regulators. The other point that I'd like to say is mRNA, the technique of mRNA, which is one of the vaccines, particularly the Pfizer and some of the other vaccines, it's a well-tested methodology. We use it. We've been using that for other things. It's not the first time we're using it. It's just so happened people are aware of it because of this vaccine as well. So they do use it. They do use these things in cancer treatments and a few other things as well in the system, old anti-inflammatory treatment and so on. So this isn't a new concept altogether, and I think people misunderstand sometimes that we've just created something brand new. Some of the things that we've done and the vaccines, the way the vaccines have been made, have actually been trialled on lots of other things, just not vaccines alone.
And I think it's worth, thanks for that, John. I think it's worth stressing what you've said before as well, in terms of those safety tests that have been done. They were done quickly, but not quicker than would be done normally. They were able to do it quickly because of all the attention that was focused on them. So all those safety tests that would be done for any drug have been followed to in exactly the way that they should be for thinking about long-term, short-term effects. And they have approved them for that reason as well. And just to add, there's been another question about time distance between the two vaccines, and I've just popped that in the chat as well that Priyani was asking.
Thank you so much. Right, we are running quite over, aren't we? So we're just going to start to wrap up. If anyone from the panel has anything else you want to add just before we kind of start to just talk through what's next, please, like Mohan, if you've got anything.
Yeah, I just want to say that, you know, I think as the panelists have all been saying, it's all about that information giving time for the patient to then take everything on board, the right information, to then make an informed decision based on what matters to them. I mean, it's a bit like personalised care, but it's so true. And it's the same for all things, isn't it, in healthcare? So I think the link workers are a really helpful tool in terms of engaging with that community to try and give them as much information as they can, and also address it and also pass those questions on to a clinician if needed, or answer themselves. So I hope this webinar has been really useful in terms of engaging that and giving them the information they need to be able to pass that on. So yeah, thank you everyone. Thank you for organising.
Thank you. Sorry, Jagan, you politely waved your hand.
Yeah, I just want to say, yeah, I agree with Mohan's points. I think for me, we've realised that I certainly have, and I think most of our colleagues have realised that the social prescribing link workers are a really important part of our workforce. And there is no way we could have been so successful with the vaccination campaign without the support of our link workers. So I think this campaign indirectly has shown that our link workers are an essential part of the fabric of our community teams. So I think, you know, thank you so much. I think, you know, for people who have been trying to push the message out, I think your demonstration of what you've done and how you've supported the community is testament alone.
Thank you so much. Leonora, Anne, anything else from you? No? Cool. Thank you so much.
Ken as well.
Thank you. Sorry, cutting you off there. Okay, I'm just going to share the last couple of slides that we have. Someone's just asked about the information that we can share with people, which actually is a nice little segue for me to share what we've actually created for you to use as a resource. Hopefully you can see my screen. Can you see it say resource pack? Hopefully you can. So basically the resource pack is I'm going to show you here. So the purpose of the pack is to ensure you have all the resources and information you need to hand, acting as basically a go-to guide to support you when talking with patients who are eligible for the vaccination and showing signs of hesitancy. So it contains all like the links to resources from Public Health England, from NHS England, and other governing bodies that all legit. And also, you know, it has signposts you to leaflets, posters, videos, translated information, and top tips that should be really helpful for you to just go over to and select and find what you need and share it with your patients. It's going to be ready this week, which is fantastic because we've been working on it for quite a while. And then it's going to be updated every month just to make sure that you've got all the up-to-date information and it's all clear, as sometimes things are, you know, changing quite quickly. So it will be available on the Healthy London Partnership website. So that's going to be in your mailbox this week, which I'm very excited about. It's been definitely a labour of love. Okay, so just wanted to thank you all as well for joining today and for your patience in joining the session and it being a little bit clunky today. So we will be sending you a feedback form request. So put whatever you want in there, be as honest as you can, and let us know, you know, the positives and things to improve for this training. It's going to be available for you, as I said, as a link. So it is being recorded, as you know, and we'll share it on the Healthy London Partnership website. So if you do have any other questions on reflection from today, please send them through to us. And yeah, we'll be happy to respond. So thank you so much for joining.